Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Well, hello, everybody. Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, and we're going to have a discussion today about autism. This is a topic I've covered a number of times on this podcast. But in this particular case, we're going to talk a little bit about autism from a global standpoint. Now, here in the United States, and this is current information as of 2023. So the recording for this podcast is May of 2024. So the current data here in the United States is 1 in 36 children in the US have autism, and that is actually up from a rate of 1 in 44. What I didn't know actually was 1 in 45 adults in the United States have autism. And we know it's more prevalent in boys than girls, so approximately 4 times. So essentially here in the US, 4 in 100 boys, 1 in 100 girls currently have a diagnosis of autism. And what's important to understand about that is that the autism diagnosis has a certain set of criteria to actually meet that diagnosis. There are other statistics that show that 1 in 6 children in the US have some type of neurodevelopmental problem. So the problem of autism and other special needs conditions is that it's getting worse. And it's not only getting worse here in the United States, but it's happening all over the world. So I'm joined by a colleague who I have worked with now for a number of years, a Dr. Sana Majeed, who is in Pakistan. And I'm going to introduce Dr. Sana, and she's going to tell us a little bit about her story, her background, and what brought her to this world of autism intervention. And we'll talk about what's happening in Pakistan and other parts of the world, that at least where she lives, and some of the people that she's working with. So Dr. Sana, welcome to the program.
Thank you so much, Dr. Woeller. It's my pleasure.
So before we get into the main topic here, give the audience a little bit of an overview of your training, your background, and what got you interested in working with autistic individuals.
Okay, so I'm a medical graduate from Pakistan, and after my graduation, I was working as a fellow resident in pediatrics. I worked as a pediatric resident for almost 3.5 years. And during my training, my firstborn child, I noticed that he wasn't speaking, he was very hyperactive, and having no eye contact, poor name response. But I used to discuss his symptoms with my colleagues, my professors, but at that time there was not that much awareness about autism symptoms. So they all used to say, like, it doesn't seem to be autism because your child is not aggressive, he's not hitting himself, he's actually he was just giving eye contact to me. So they assumed like he has eye contact. So these were some issues because of which I wasn't able to get him diagnosed on time. But unfortunately, in my last year of residency, when he was turning 4, so I officially got him diagnosed for autism. And at that time, it was a really big news for me. I was in a very big denial. I went into severe depression. And at that time, me and my husband, we decided to move to US. We were in North Carolina at the time when I started reading some research papers about biomedical interventions for recovering autism. So as I told earlier, that I was in a denial phase and depression, so I wasn't ready for the therapy stuff and all that. So reading some of the recovery stories, I got inclined towards using biomedical approach for my son. And I started reading some books. And at that time, NAMCHEC protocol was very famous among the parents and easily available. So I started with that, and then followed by that, I got to know about the Great Plains Lab, which is now being called Mosaic Diagnostics. So I got some of his specialized testing done from Great Plains Lab, and that opened a new chapter for me. Looking into the food intolerances and the toxicities he had, being a medical doctor, I realized that these issues exist from a medical standpoint, but there was no correlation of autism with these toxicities. And I never read about those during my whole medical career. So this is how I got connected with biomedical interventions. And then I decided to use biomedical strategies for my son. And this is how my biomedical journey started.
So going back to your son and when you first got diagnosed, was there, as you look back now, was there anything that you've been able to figure out maybe was associated with the development of autism? Was it regressive, for example, where there was typical development for a period of time and then he regressed? Or was it sort of just a lack of development over time?
From biomedical aspect, Dr. Woeller, he had all kind of toxicities. Like I can now, if I go back in past and I see his videos and I think about my pregnancy, basically this all started with I never having a healthy lifestyle. I was having a lot of gut issues. So basically I conceived him on medication. There was a lot of stress being a medical profession, working day and night and not paying attention to your own health. So now I understand that basically my own gut flora was too disturbed when I conceived him. Perhaps I was having severe depression, anxiety. I conceived him on medications. Then I was getting vaccinated. And especially when we moved to US, we like a lot of time while traveling, we got influenza shots, which is not a routine here in Pakistan. But having said that, starting from my pregnancy and as soon as he was born, I remember he had neonatal jaundice. He was admitted to neonatology unit. He was having antibiotics. And then as soon as he was turning 2 to 3 months old newborn, he was having severe colicky abdominal pains. I used to take him to hospitals in emergencies. I still remember, like, I used to take him to the ER, and doctors, they used to ask me, like, we have a lot of emergencies, why you were bringing a child, just a colicky child here in ER. But basically, he used to cry so badly that it always gave us an impression that there is some emergency going on. Along with that, he had a lot of diaper rashes when he was turning. And then at birth, his sucking reflex was so poor, I wasn't able to feed him. He went into bottle feed. And when he was turning 3 to 4 months, I noticed now he was passing one stool that was just watery, so much foul smelly, having lots of mucus. So just pale in color. I used to visit pediatrician that I think this is not normal, but because it was only one stool per day, so they didn't take it as something abnormal. Then there were frequent diaper rashes. Sometimes he used to pass stool, which used to give him burns over his anal area. So with all this, when he was turning 6, I thought like he is hungry. He was getting like very disturbed. His sleep. One more very important thing. This is the child which was, as when he was born, he never slept whole night for even a day till he was 4 years old, and I started him on supplements. So like he wasn't sleeping. He used to wake up every hour at night, starting from 12 midnight to 6 in the morning. So this was something unusual happening. Again, when he started walking, he was fine. Otherwise, his other developmental milestones were okay, except his name response, eye contact. And when he was turning 1, he wasn't speaking a single word. I just remember at the age of 12 months, only one time, maybe he said, Baba, Dad. And that's all I remember about him. And then automatically, when he started walking, he was very hyperactive. He started running. He had no danger concepts. He used to grab dangerous things, knives, sharp things. So this made us very concerned about him, and we used to lock him into our room, and we started staying inside our houses, and like we stopped going outdoors to malls. He used to run. He used to go for escalators. So this is how like he was now becoming very hyperactive, and along with this, at the age of 12 months, he had asthma. His first asthma treatment and nebulization and steroid, it started on 12 months of age. And then he was having some non-specific kind of skin issues, not diagnosed by any dermatologist. They used to say it seems to be, sometimes they used to call it contact dermatitis, sometimes they used to call it urticaria. And the last nail in the coffin was at 15 months of age when he got vaccinated for MMR. And till the age of 15 months, I was very specific, particular about his vaccination. I used to travel to another city to get him vaccinated to the best medical facility in Pakistan. MMR was that kind of experience. Like when they injected him with MMR, I remember he cried so badly within the next few minutes that it was a very big issue. Like I wasn't able to get him back to home. He was falling out of my hands. He was so painful. He was in so much pain. And after 3 days of getting MMR vaccination, I noticed that he started developing high-grade fever, flu-like symptoms. And like I remember on the 7th day, there was a rash. And when I consulted his pediatrician, that it seems to be measles, but how can he get measles when there is no epidemics, right? There's no season. So how can he get measles soon after getting MMR? They said, you are lucky that it seems to be very controlled because you vaccinated him. So at that time, we started getting.
So they actually said, it was beneficial you got.
Yeah, it's right. Yeah. So at that time, since we got MMR, from that time period, my child started having sensory problem, all kind of behavior issues like crying, weeping, refusing food. I have his pictures. His face was like this. He used to search for different stuff on floors, putting things in mouth, and then crying and weeping all the time. He lost eye contact with me as well. His name response, each and everything. Now he started spinning into circles, playing with non-toy items and staying away, sitting alone. Some people were, when our family used to visit us, they used to say, you guys are really lucky, you're kind, your kid doesn't bother you. He's playing alone, sitting on a corner. So, and this is how he was developing classical autism symptoms. But because of his hyperactivity, basically, we were modifying our lifestyles. He was sleepless. We were sleepless. I wasn't having any understanding what's going on, my work, commitments, and all that. So when he turned 3, there were many accidents which happened. And fortunately, he was saved. For example, he had severe kind of water obsessions. We were at the beach and he was almost drowned, but someone saved him. I had no idea that he's having such a kind of severe water obsessions. I used to offer him water and all kind of things. He used to play. I used to offer him, like we were in our own world. We were making him more comfortable with everything he used to enjoy. So finally, at the age of 3, I thought, we were living alone and he's the only child in our family. So I should get him admitted to play group preschool so that he might start getting socialization and he would see other kids speaking and then he would start speaking. But again, he went to playgroup, but he was getting hurt by other kids, and the teachers used to say that he prefers to sit alone. Somehow we completed 1 year of that playgroup. He used to go for 2 hours alone. And when we ended up, and he was turning 4, a colleague of me suggested me that, why don't you go for speech therapy? If you don't want to get him assessed for anything, just get his ears testing, because now it seems it's not about his speech, but it seems more of his hearing. He's not responding you. He's not listening to you. So that was the time I started speaking him a lot with him. I tried manding. I used to keep him a little bit hungry so that he can ask me for food. I tried all these kind of tricks. Maybe he speaks, but no, nothing happened. And then finally, at the age of 4, when I started his speech therapy, the therapist suggested me that you should go for a formal diagnosis. And then there was a 5-day assessment done where he was diagnosed as moderate to severe autism, having poor IQ level and blah, 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 poor fine motors.
And that was around the age of 4 or so?
4, yeah.
4,
yeah.
Okay. So it's, your story is very similar to what I've heard over the years. I mean, every kid's a little bit different, but then there are certain cases where things are quite dramatic. And clearly with your son early on, there was obviously digestive system problems. And I think what's important for people to understand is that what happens in the digestive tract from a dysfunctional standpoint and the different compounds that are produced, whether they're produced via just generalized inflammation or food sensitivities or overgrowth patterns of different opportunistic organisms, well, those reactions find their way throughout the rest of the body, particularly into the brain and nervous system. So kids with autism, and let's also mention that it's not just autism, right? We're putting this in the group of special needs because it could be other individuals too.
Exactly.
But the brain and the gut are connected, and so very, very common situation. And one of the things that I've seen over the years, Dr. Sana, is that when I look back and if there is a pretty clear association with certain vaccines, the MMR seems to often be at least the major catalyst or one of them. And there are mechanisms for why that can be, from an immunological standpoint, triggering inflammation. Of course, you've got mitochondrial dysfunction. Yeah. And so essentially what was happening with your son at the time is his brain was on fire, and that you get these immunological reactions that start to hit the brain in different areas. So before we move on to some other topics, I want to just find out real quickly, one of the things that I often ask parents with regards to what's happened to their child or where they are currently is language, social, and behavioral problems. So you mentioned that by year 1, I believe it was, that he was either nonverbal or pretty much nonverbal. Socially, it sounds like he was pretty isolated, and maybe that was just self-isolation because he didn't really know how to socialize. But was he self-injurious or aggressive? Was that a problem?
Yeah, it wasn't a problem till he was 3.5. And that was the point. Because of that, I was actually, and my colleagues and everyone I used to discuss about him, we were missing his autism, because there was a concept that autistic kids are self-injurious, hitting, self-biting and all this. So till the age of 3.5, he wasn't self-injurious. Though when I look back into some of the pictures, I found that there was a time when he used to bang his head like this, and my lower lip used to get so much bleeding points and everything. And it was like there were 3 months consecutive where my lower lip was bruised and bleeding. So I had no idea that basically he was hitting me or hanging his head over me. So he was not that much aggressive, like he wasn't self-injurious, but at the age of 4, he was trying to hurt me and others when he wasn't able to express himself.
Right. Yeah. And that's a very common thing. As kids get older, they become more, I would say maybe more irritable or frustrated because they're having difficulty communicating. So there's a wide spectrum of this. So it sounds like in Pakistan, just like it here is in the US, and I've consulted with parents all over, it's pretty much everywhere, the conventional or traditional medical system, for the most part, is relatively clueless about what's going on and what to do. And so other than here's some medications or here's some, speech therapy, et cetera, but that's pretty much all they can offer up. And you and I know that pretty much goes nowhere, right? That doesn't lead to any point really of health recovery.
Yeah.
So it doesn't sound like in your medical training that you really got any kind of training with regards to autism.
No, I remember I was practicing in Pakistan's one of the most famous medical university, and that had the biggest patient load from all around my country. But I never had seen or heard of autism even in my residency. And even right now, even if I know medical professionals, they know about autism only if they have a child on spectrum or they have someone in their family. Otherwise, there are a lot of medical professionals. Many times when I visit different medical universities and we are talking about autism, every time I meet 4 to 5 doctors sitting there whose kids are on spectrum and they are not aware of what is autism. So from the biomedical aspects, even if you just leave it aside, the medical professionals, they lack any awareness about what is autism, and autism is getting so common nowadays. It's the rate how autism is increasing. If we keep aside the parental awareness, I am worried about the awareness level among practitioners.
Well, that's very true, and it's the same thing here. It's the same problem here. I mean, we're a huge country here in the U.S. Over 330 million people, for example, but it's still there's just not a lot discussed. Or if what is discussed is pretty much just talking about rates, and then some meds, some therapy.
Yeah.
That's it.
Yeah.
One of the things I wanted to ask you is, what is the awareness in Pakistan amongst, let's say, the parent community? We know that the medical profession is lacking awareness. So they might, at this point, they probably heard of it, but they're not really sure what to do. What's been your experience as a pediatrician amongst parents in Pakistan? How much is the information getting out there? Are there parent support groups there? Are there networks where people are kind of teaming up trying to disseminate information?
Yeah. Luckily, because the awareness campaigns and webinars and all the stuff available over internet, and especially the biomedical experts and all other experts related to therapies and all that, when they became available online during the pandemic, I'm happy to see the level of awareness among Pakistani parents. I'm really happy because if your child is suffering, parents wants to do anything for them. And if you get to know about autism, as I was told that my child is gonna stay like this forever, there is no clue when he's gonna speak, and don't think about his schooling. And at the same time, when I got to know about even one recovery story in any part of the world, an autism parent would like to look into that, and they would do everything to get at that point. So here in Pakistan, not just parents, the therapy centers, the heads of the therapy centers like ABA and speech therapy centers, I got a lot of referral from them as well. And then because of the social media awareness, people are really much aware regarding therapies and biomedicine as well. And in Pakistan, the assessment system for formal evaluation of autism is not that much difficult. So people get early diagnosis and early assessments and early interventions very easily. So I know a lot of families from states, Pakistani families from states, Canada, or UK, especially UK, they come back to Pakistan. They stay here for 6 months to 12 months for their therapies, to start supplements for dietary intervention.
So I've consulted with some families in India, and my impression of what's happening there with some of the parents, particularly what kids are being exposed to, is very similar to what is happening in Pakistan too. So we've done some work together where we see, like high levels of lead, for example, and other chemical compounds. Where else are you communicating with people from? What other regions? You mentioned UK and Canada, but sort of maybe, is it all just within Pakistan? You got people coming to you from all over?
The major chunk of my patients are from United Arab Emirates, Saudi Arabia, UK, US, Canada, Australia, and Denmark as well. Yeah.
Okay. And essentially, the rates, we know, I know they're probably not as well organized. I don't know if that's the right word in what's happening here in the US, but we're kind of looking at this as a general, the rates, if the rates are 1 in 36 here in the US, it's going to be pretty similar in these other countries.
Yeah.
And I'm assuming that's the same in Pakistan too. So let's get into some aspects of, and first off, I want to just define biomedical intervention for people who might be listening or like, well, what does that mean? So one of the things you mentioned early on with your son was the typical thing that happens is these kids start having a lot of medical issues, digestive problems, chronically ill, frequent ear infections, rashes, for example, and they get looked at or evaluated and not much is done, or maybe a stool test or sometimes blood test might be done, but that's pretty much it. And so the medical system's just as well, it's just kind of part of growing up, not a big deal.
Yeah.
And I've seen that for decades now. It's the same sort of thing plays out all the time without fully recognizing that there's an underlying medical problem that is occurring. And so those things are happening for kids all over the world, right? It's not just a US problem where they have gut issues or a Pakistan problem where they have a rash, right? These are just universal aspects of what's happening physiologically. And so biomedical intervention is the understanding that autism is not just a neurodevelopmental problem. It is a multi-system problem that there is underlying biochemical, biological abnormalities that are either causing or contributing to many of the things that we see with regards to language problems, socialization issues, stereotypical behavior. And so another word, at least in my vernacular for biomedical, would be integrative medicine or functional medicine applied to an individual with an autism spectrum diagnosis. And so we're looking at gut function, diet, foundational supplementation, and all of these other things. So that biomedical word got attached many, many years ago. It still fits, but so that's kind of the overall approach.
Yeah,
so
exactly.
What are you finding in Pakistan, or maybe with some of the other countries of where parents are coming from? What are some of the major challenges that they are facing? I'm assuming it's going to be similar to what you experienced with your son, but what I mean by the challenges is either lack of awareness or problems in implementing different types of therapies. What are some of the challenges that might be unique, for your patient population?
Okay, so Dr. Woeller, I would categorize the challenges for two groups. For example, one group is the group of people who are not having financial restrictions and like they're ready to go for anything. They don't have any affordability problems. For that group of people, there are no much challenges, especially in Pakistan, UAE. The therapy setups are very equipped. They have foreign qualified professionals working there. We are doing early interventions, early assessments, everything. The biomedical facilities, especially in Pakistan, my clinic is the first kind of its clinic where we are trying to we are trying to implement the biomedical strategies for an autistic child. For example, referring them to proper therapies as well, looking into their diet, their growth, referring them to an ENT specialist if required, a gastroenterologist if required, a neurologist if required, and working on their overall health plus their therapies as well. So for this category of people, they do see magical results among their kids within no time. But the problem comes where the affordability, the financial problems come. Obviously, having, like in Pakistan, there is no government setup for therapies and all stuff. So people have to do it on private. It's very expensive to to pay for the monthly charges, especially the therapy setups and all major medical setups. These are found among the major big cities. In villages, in small cities, there are no therapy setups. There are no assessment facilities. Obviously, to doing some dietary changes and all that, it's very difficult for them. There is no support for government. There is no special education system here. If any of my patient becomes ready for schooling, we don't have as such inclusive setups or remedial schooling here. So they have to do it is on their own. So finances is a very big problem, and secondly, followed by awareness. Yes, like even a mainstream medical physician can do a lot for an autistic child who's a picky eater or who's having chronic constipation or frequent upper respiratory tract infections, if they understand that they need to be treated.
You know, you bring up some really good points about affordability, and that's going to vary depending on, you know, where people are, what they have, and honestly, some of the affordability depends on their perception as well, right? So what's affordable to one person may not necessarily be from a financial standpoint. So that challenge exists all over, and it's the same thing here. It really depends on what state you're in the United States. California was a state where I came from, but they had pretty good resource services. But other states aren't, they're not all the same. So it's just different where you are. So, by the way, before we get into your approach, real quickly again, go through some of the training you went through that helped improve your awareness as a physician. Because as a pediatrician, it's amazing, right? You had really no awareness as a pediatrician. You know, you think one group of medicine who should have full awareness about what to do would be pediatricians. But that exists everywhere. So what were some things that you did that helped you along in being able to implement this world of biomedical intervention?
Okay, so when I was looking for treatment options for my son at that time before pandemic, it was really impossible to get connected to any of the biomedical experts anywhere in the world, because obviously there are very few biomedical experts all around the world. So I started reading some books, research papers. I started with Dr. William Shaw's books. And then when I got to know about the specialized testing, organic acid test, IgG food map analysis, mycotox profile, and heavy metal analysis. So I thought that I need to see what kind of issues my son has, because I can't rely on bookish knowledge, and I can just assume, though I was seeing the signs, like I was able to see that he seems to be high on lead levels. He seemed to be allergic to casein and gluten as well, because regarding the history I shared with you, he was severely constipated. He had all his cervical lymph nodes enlarged for years. So he was showing me signs of autoimmunity. He had many signs of MTHFR, stork bite, vein on his the blue vein, and then the capillary hemangioma, everything. So what I did was, like, first I started with sending his samples to Great Plains Lab again, which has been converted to Mosaic Lab now. So once I sent his samples from Pakistan to US to the Great Plains Lab, when I got the results, I was totally blank what to do. So the lab got me connected to their medical experts, and one of them was Dr. Woeller. And I started attending the webinars, and within no time period, I got some knowledge about like putting him onto gluten-free, casein-free diet. I started with that. And when I saw improvements, like within days, within weeks, his eye contact, name response, his gut was getting better. He was passing stool every day. His rashes disappeared for next 4 to 5 months. I didn't put him on any medications. There was no flu medications going on. His rashes disappeared. At this time period, he had some issues in his oats, candida, clostridia, neurotransmitter imbalances, lots of vitamin deficiencies, and I was totally blank. So at that time period, like the GPL representative, they shared with me, like, I can do lots of online certifications to being a medical professional. So I attended the OATS mastery course at Integrative Medical Academy, and followed by the SIBO mastery course. As soon as I got treatment protocols for based on the findings we see on oats, I started implementing those for my son. I treated his candida, I treated his clostridia, and I saw improvements in his. He used to have a lot of self-laughing, very hyper-excited all the time, running. So his hyperactivity was controlled after treating candida and clostridia. He was sleeping whole night. Like within 7th day of treating candida, when he slept at 10 p.m. and he wasn't awake till 10 a.m. in the morning, we took him to the hospital. Like, how is this possible? This child is sleeping for 12 hours. It's been 4 years. So there was magical results. So these improvements inclined me to get into more depth of biomedicine. So the treatment protocol I got from my OATS mastery, SIBO mastery, it had a lot of details on how to use supplements, how to use prescription medications. So being a medical professional, it was really easy for me to understand that. I started using those as soon as there were improvements in my son's behaviors, and he started speaking within a month. There were a group of 20 to 25 parents who wanted me to do same strategies for their kids. So this is how I started working for other kids.
And you've also done training through MAPS, right? The Medical Academy of Pediatric Special Needs, which has a conference twice a year, which I'm part of as well.
Yeah. So like MAPS is important from the standpoint, like research standpoint. They share up-to-date, cutting-edge technologies. It has a lot of references, up-to-date research papers. So that really helps me to collect data. When I'm talking about any biomedical remedy strategy here with parents or professionals here, they ask me questions like, these are not FDA approved, or these are not found anywhere in our medical curriculum. So do you have any researches, any data to back up your knowledge? So the MAPS conferences, they really help me a lot to back up my statements. And I'm starting to work on the research, many biomedical intervention researchers here in Pakistan as well, so that we can collect more data.
Yeah, that's great. So let me set the stage, because a lot of things that you talk about. So organic acid testing, what's called oat testing, food sensitivity. So one of the things we know is we've known this for many years, but it still holds true today, is that the vast majority of individuals with an autism spectrum problem often have gut problems. Now, it's not the same thing for everybody, but there is some type of digestive system imbalance. Constipation's a big one. We can have inflammation. We can have overgrowth of candida, clostridium bacteria problems as well, and the compounds that they produce. So digestive system issues are very common. They also have many food sensitivity reactions. It's not just gluten and casein, but those come up quite a bit. And it's not just a food reaction from an immune system standpoint, which clearly does happen, and that causes inflammation, and that can cause gut problems. But the chemical structure within those foods, these opiate peptide-like structures, which actually can interact adversely with the brain and nervous system, which can affect language and eye contact and awareness. We also know that many of the kids or adults now really have just poor detoxification capacity to whatever they're being exposed to. It could be metals, could be mold or mycotoxin, could be environmental chemicals, could be compounds in their food. So there's this collective problem. And so that's really the fundamental aspects of biomed, is looking at those foundational things. They also have many nutritional imbalances. Some of it is imposed on them because their gut can't absorb things effectively. Others, it's self-imposed because they just have selective eating habits. They're just not eating a diversity of food. So I've often talked about the early stages of biomedical intervention. And this is applicable, this information is important for practitioners that are listening to this or parents. In what I developed many years ago was the 4-pillar approach, at least the way I viewed sort of the early stages of biomedical intervention. You have to understand the importance of a healthy diet. We know that many kids have nutritional problems, so just foundational supplements to fill in those gaps nutritionally. We pay a lot of attention on gut issues. And then there's this other category called methylation, right? Which is this methylation chemistry, does a lot of stuff in our body, but it primarily is going to help with brain and neurological function. So with all that in mind, because I know you've gone through some of my courses and you're part of the MAPS organization as well, when you have a parent come to you now, okay, give the audience just a general sense of what is your approach, kind of what are you looking at, and what are you first recommending to that parent, sort of number 1, number 2, number 3, the first places to start, and then things to look at down the road?
Okay, so my approach for a patient who is coming to my clinic is, once I take detailed history and examine a child, there are lots of factors for which we can straight away start working on by seeing the child, getting the history. For example, if child is having chronic constipation, frequent upper respiratory tract infection, we can work on his immunity, and severe picky eaters, we can work on some fundamental nutrients, micronutrients level. So I try to make a combination of a treatment plan based on the symptoms, history, having some baseline supplements, and then followed by dietary interventions, dietary changes. Most of the time we start with gluten casein free diet. If a child is having is very aggressive or hyperactive and is showing sign of food intolerances, in few cases I have to go for GAPS diet as well. I'm Pakistan's first GAPS diet consultant here, but I found it difficult for parents and kids to follow GAPS. So most frequently we go for GFCF and followed by GAPS if required. And then I counsel parents for the necessity of important testing. So if they are ready for that financially, or I just guide them over the first and the foremost important test, so that they can just do step-by-step testing based on their finances. So the commonest test I utilize is food intolerance, IgG food map, oat test, heavy metal analysis, hair sampling, mycotox profile, and stool analysis if required. So after you get, once you get your reports based on these testing, you have a lot of issues you can work on. You get a list of problems, and then you can prioritize your treatment options. Most of the time, in 80% of kids, they do have candida or clostridia. So we have to start with some anti-candida probiotics, followed by some basic nutrients. I also like to do some baseline blood work, which is easily available here in Pakistan, like iron levels, vitamin D levels. Interestingly, 95% of autistic kids who are having mouthing habits or putting things in mouth, it easily gets resolved by supplementing iron and or zinc. So this is how I start. And then once we have our testing done, like we have some, like a list of problems, we can work them. We have good time, like from 8 to 10 months, you can work over those issues. And along with that, you see changes in your patients. I like to use B12 shots if required. I like to add hyperbaric oxygen therapy and neurofeedback therapy for my patient as well, wherever needed.
So let's go back real quickly. So the organic acid test was also called the OAT test. That's a critical test to do. In fact, in my practice, I do similar testing to what you're doing initially. If a parent can only afford to do one test up front, well, it's always going to be the organic acid test, unless they just recently did it. But that's a go-to because it has so much information.
It's the one test which can give a lot of information on many organ systems of your body.
Right. So the same thing. We know that diet plays a huge role. That's an evolving process. There is no one diet for autism, right? There's a place to start, but it can be different things for different people. But generally, the gluten casein-free diet is a good place to start. The Candida Clostridium problems are very, very prevalent, as it sounds like it was with your particular son. And then one of the things that we've seen when we've worked together, and again, I've seen this in some other countries, very high levels of lead. So there must be just prevalence of lead in the environment. We've not been able to, whether it's coming from the water or in the soil or wherever, there's just a lot of it. Same thing in India. I've done some work with a group out of China, and those kids are exposed to, I've seen some of the highest lead, mercury, and arsenic levels of those kids. So that's quite prevalent. I don't see that much here in the U.S., but again, there are certain places where lead or arsenic show up quite high.
I see high levels of lead in Pakistan, more in UK and UAE, and in the third number in Pakistan.
Yeah, okay. And then I know one of the other things too is the mycotoxin issues, and this could be another entire interview discussion that we could have, Dr. Sana, on mold and mycotoxins. But when we've actually looked at many of the mycotox profiles of families there, they're often very high with certain mycotoxins, particularly to Aspergillus mold. I've seen that also with some families in India. And I don't want to get too far off topic here, but one of the interesting things I found and I don't know if this is just in Pakistan or India, or if this is kind of across that region of the world, but you tend to have water heaters on your roofs.
Yeah.
And I've often been suspicious that may be, we could have mold contamination here too, but most homes in the US, at least most modern homes, the water heaters are usually in the garage. So I'm just wondering if that is some sort of unique circumstance where there may be a leaky pipe could more easily cause water into the walls.
We do have system like that, but fortunately, what my observation is, I have found my patients here in Pakistan to be more responsive to mold treatments than my patients in Europe or US, because we have dry weather. And it's not difficult to get rid, even though if we have leakage somewhere, you get it repaired. The weather is so dry and sunny, it gets dried easily compared to, like, I have a lot of patients abroad, they change their homes, whatever, but they still have hidden mold, and the weather is so cold, the temperature, it doesn't allow them to get rid of mold properly. You get them retested and it comes back again.
That would be certainly some case with some of the families in Europe, particularly the UK. So, as we kind of wind things down here, what you're finding in the families that are coming to you, it sounds like it are things that you originally found with your son. So, real quickly, what did your son tend to respond well to when you look back in time, right? He gets the diagnosis of autism at age 4. He had all these gut problems. He regressed after the MMR. Things got much worse. There's a lot of inflammation. But what were the therapies that really were a major hit for him?
Okay, so Dr. Woeller, I would say I was fortunate enough that whatever remedies I added for him based on his problems in his testings, they really worked magic for us. So I worked on his health issues. That's all. I never went for any kind of speech therapy, behavior therapy, occupational therapy, never ever. Yes. It took me some time. For example, I told you, like, earlier when I was just a medical practitioner, so I started him on GFCF and I had no clue what to do. I got him tested. I had no clue what to do for his oats. And then I got attached to Integrative Medical Academy. So I started his treatments. So I was treating him every 3 months. I used to add a new remedy for him based on the knowledge I collected from webinars and international doctors. And luckily, I also joined a lot of international biomedical doctors forums where I was able to discuss my issues and ask for the suggestions, especially the doctor forum at the Integrative Medical Academy as well. So I was treating him every 3 months. I used to see a set of problems going away and a new set of problems were there for me. He responded very well to GFCF diet. He started sleeping, having a natural sleep. His hyperactivity was 50% reduced. As soon as his hyperactivity was reduced and he maintained 30% eye contact, I was able to got him admitted to a mainstream school again. At that point of time, he wasn't verbal, he wasn't speaking, but because he was not hyperactive, his sitting was good, so school gave him a chance. And as soon as I started treating his candida, this is so amazing that I have hundreds of kids where I treated candida and they were verbal. Yeah. So we treat constipation, they start speaking. You treat Clostridia, they start speaking. So this same happened with me. I was working on his Candida, Clostridia levels, and then he started speaking few words functionally. He was participating in school 30-40% of the time. And then when he was turning from 4 to 5, he was able to express himself in phrases depending on his own choices. He would talk about his preferences, not what we want to hear, but he was able to talk about like 20-25 different things of his own choices, what he want to eat, where he want to go. And that was amazing for me. I was happy with that because I was told he was never ever be able to join a mainstream school. So from 4 to 5, I saw these changes. And till that time period, I had not treated his lead levels. He had high levels of aluminum and lead. And I was really scared of going for chelation. And truly speaking, I had no idea what to do. But again, then I started studying about chelation. And then once I started treating, detoxifying his lead and aluminum, I saw his pencil grip getting more improved, his focus getting more improved. He was promoted to next class easily, which seemed difficult. And at the age of 5 to 6, he got some basic academic skills. His pencil grip was fine. And then at this time period, he was able to communicate with the person back and forth in simple 1 to 2 sentences like, hi, how are you? I'm fine. Where do you want to go? I want to go there. What do you want to eat? I want to eat this. What if I don't feed you? What if I don't take you to the play area? What you want to do? No, you promised me. Why you were lying to me? So he was able to communicate back and forth. Then COVID came. And it was a great opportunity for me. I got more connected to international biomedical experts. I learned a lot. I started my online certifications, my GAPS consultancy program. I got connected to MAPS. And then I started him supplements for him. Like now I was confident enough. I blindly added whatever he needed. And at the age of 6 to 7, he was 100% recovered. He was a normal child. And the only problem was that at the age of 7, he was lacking behind in cleverness, wittiness compared to his peers. But fortunately, from the age 7 to 8, I would say like he is just like a normal 8-year-old boy, clever, doing perfect in schooling, in computing, gaming, some of other subject. He is more better than his class fellows. So like now I don't feel that he's lacking behind in any area.
So that is fantastic. Congratulations. Yeah. And I think that one of the key points is that it's a process that evolves over time. It's not something that just happens within 2 weeks or over a weekend.
He is casein free. Sometimes people ask me like, for how long you were on biomedicine and are you still? Yeah, he cannot tolerate casein. Even if I try feeding him dairy today, he would lose his focus on the 3rd day. I would receive a call from school that he's not answering. He's looking at us. He's not answering properly. So he is casein free. Yes, I like to use many of the supplements up till now. I like to use omegas, probiotics, many vitamins, because basically our diet is deficient.
Yeah.
So it's a lifestyle.
And that's the key point. It's a lifestyle. It's for the long haul. These are not things that often just turn around in a short period of time. It's a commitment over time. And really the whole family has to be on board. And so, congratulations. I've done a number of interviews with other parents, and there's always kind of a theme, right? There's one child who got extremely better when they did metal detox. Another one got extremely better when it was antifungals. Another got extremely better when they did methyl B12 or methylcobalamin interventions. But underneath all of that was the same types of things: foundational supplements, removing toxic foods, working on gut function. There's these fundamental aspects that have to be in place. And so all of those things, it goes back to those foundational approaches. So fantastic. So happy for you and your family. And I'm also just extremely pleased to know that you're out there, able to help families, not only in Pakistan, but many of the other countries that you connect with, because it's doctors like you who are really changing the narrative around the world. I mean, it's a big enough struggle here in the United States to get the awareness up. There's organizations like MAPS, which are tremendously useful and needed and necessary. Yes. But we're still behind as far as how many practitioners know what to do or have an awareness, particularly since the rates are increasing so profoundly here and elsewhere. So how do families get in touch with you?
The major chunk of my patients come from through the referral system, because fortunately, I'm having very good response from my patients. So my major chunk of patients come from the referral system. I don't get that much opportunity to advertise on social media, because I have a lot of patients. Like my workload is already too much, so I'm not able to use social media for that. But I do have my Facebook page on the name of Bioheal Spectrum, a YouTube channel. So many people approach me from Facebook and YouTube as well.
And when we on our website for the Functional Medicine Doc Talk podcast, on the page, your profile page will be your information as well. What about practitioners that are listening? Where would you recommend they go, or what are some resources you'd recommend that practitioners get involved in?
I would recommend mainstream medical practitioners to look into depth of biomedicine. They should attend. There are a lot of online resources available. They should attend the webinars related to biomedicine. I also shared my experience about Integrative Medical Academy. It offers a lot of in-depth courses. I still have to go for two more. I have lined up 2 more certifications for myself yet, because being mainstream medical practitioners, we need a lot of information on how to use supplement, their dosages, especially because there are some supplements which we use in high dosage. So if you have got some guidelines, like being medical practitioners, I always missed one thing, that we were already trained under supervision. So when I wanted to start biomedical treatment strategies for my patients, I was looking into some supervision. That made me join Integrative Medical Academy, where I was attending your classes, and then followed by the treatment protocols I have received. So I would suggest everyone to look into that. I would also suggest practitioners to attend MAPS conferences. They are loaded with up-to-date information, latest researches, lots of information, reliable resources. So we should upgrade ourselves.
Right. Well, that's a great advice. And any final words? Any final words you have for our listeners as points of emphasis, encouragement? Any final thoughts?
Yeah. So I would just like to summarize. I have my journey. I was an autism mom. I never had thought that my child would be able to have a normal life. I see hundreds of other kids having lots of normal life. They were on spectrum. They're losing their diagnosis. I want everyone to believe, whatever severity level your child is, I want all parents, all practitioners to believe that autism is something which is not incurable, or it's like there is a debate that it's not a disease, why we want to treat it, why we are talking about treatment. It's not a disease, but that's a human. He has a lot of medical issues. Like if a child is coming to a mainstream pediatrician with picky eating, with poor growth, poor weight, pale in color, putting things in mouth. I was taught by my professor, if a child is coming to your clinic cranky, crying, first start him on iron and B12. What about an autistic child? If an autistic child is coming to your clinic with all these symptoms, stubborn, cranky, crying, why do you want to get him testing on iron? Why don't you want to work something over his growth? Why don't we want to, if he's getting sick, he's getting upper respiratory tract infections, why don't we want to work on his immunity? He's a human. So 90% of autistic kids, adults, teens, they have many medical issues. And when, like, after doing in-depth testing, I am finding a lot of severe pediatric issues as well. There are a lot of kids on autism, they have thalassemia minor. There are a lot of genetic mutations. There are a lot of hemoglobinopathies going on. So, like, at least take a child as a human, and an autistic child deserves more in-depth investigations and treatments compared to a neurotypical child.
That's exactly correct. And I love you saying that, because I've talked about those same types of things for years. It's like, it's a child who's under distress. Look at their health, and work on health and work on their underlying function. You'll often get improvements in their overall behavior and overall health. Real quick story before we end this. So to your point, I had a patient years ago. Now, he wasn't a primary patient at the time that this was happening, but this was relayed to me from the parent. They had an older teenager who had self-injurious behavior. For months, this individual was hitting themselves in the mouth, and their lip was swollen. They were all bruised, and it went on almost continuously for a number of months. They had seen a couple neurologists. They had been to a few other doctors, and they said, well, that's just autism. That's just a self-stimulatory behavior. They finally went to another doctor who said, when's the last time your son has seen a dentist? And they're like, well,
Yeah.
It's been a number of years. We can't go to a dentist because he has to be sedated. And so he lifted up his lip, and it was all bloody and bruised. He went to a dentist. He had a cavity.
Yeah, very common scenario.
He was in pain. But the medical profession assumed that the behavior was somehow related to his autism. Although when you look at the diagnostic criteria of autism, nowhere on there is self-injurious behavior hitting your mouth. So
Exactly.
there's blinders on, still.
I would like to add here, Dr. Woeller. I see kids having, like, parents says that they are having visual stemmings, but they have vision loss. They are having squints, but like we are just labeling them with visual stemming. They are having motor tics. They are having what do you call them, like vocal stemmings, and a lot of other, everything is just sensory overload or stemming. And once, like, there are 40% of the kids who are very irritable, having sleep issues or excessive crying, they are having seizure disorder. Yeah. Sometimes they are having fluid in their ears. They are banging their head. They have fluid in their ears. They are having very less vision because of watching screens and all that. So there is no referral system. There is no examination system. We are counting everything as a behavior. There should be some baseline investigations. There should be some guidelines made for an autistic child to examine them from head to toe, ruling out seizure, very important. I'm seeing seizures so commonly. And when I refer them to a neurologist, they just call the parents like, why you did this EEG?
Right.
And they are not treating seizures.
Yeah, it's a very common scenario. Well, we certainly could talk for hours and hours, but again, I want to thank you again for what you do and for our work together and the involvement that you've had. I've always found you to be, very thorough, very conscientious, very great to work with. And I know you're helping families, throughout Pakistan and elsewhere with your knowledge and your compassion. So thanks again for joining me today.
Thank you so much, Dr. Woeller. And I especially want to thank you for all the guidance. My biomedical journey started with you. I owe my son's autism recovery to you. So thank you so much again.
Thank you.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.